So Dr. Toor,
So
Dr. Toor was born and raised in Edmonton, where she attended the University of Alberta before receiving her optometry degree from Cardiff University in Wales. She's now practicing in Calgary with a special interest in pediatrics and binocular vision. Dr. Toor works with all ages of Albertans and ensures her 65 plus patients understand maintaining their eye health is her priority. She's done many senior home visits and will continue doing so to help patients who are unable to attend the clinic. She enjoys traveling, skiing, and spending time with family and friends. That's a great introduction. So I'm gonna fade into the background and turn it over to you. Welcome.
Thank you. I appreciate that. Thank you for the wonderful introduction. I appreciate that. So good afternoon, everyone. First of all, thank you for joining us today to learn the importance about your vision and eye health and how that works together to maintain the lifestyle you want. So I'm just going to take some time today to share some insights on what your doctor of optometry is looking for during a comprehensive eye exam and how we do things daily that can affect our eye health. So at the end, I'll leave you with a checklist of things to do to help maintain your vision and your eye health. So wonderful. I'm just waiting for my slides to load here. If I can, perfect. Thanks, Tori. Perfect. So next slide here. So I know we're not doing any polls for this particular lecture here today, but just to have in your back of your mind, how often should seniors have a comprehensive eye exam in your opinion? Do you think it should be annually? Do you think it should be every 2 years, every 5 years? So just keep your answers to yourself over there. Next slide. So when you reach 65 plus years of age, it's recommended that you have a comprehensive eye exam every year. So there's a very good reason for these regular exams, because as we age, our vision, our eye health can change quite rapidly. And an eye exam is what your eye doctor is providing you with, and it's very different from an eye test or a sight test, as some of us may know it as. So it's just not whether you need glasses or whether you need a change of prescription. So think of your eye exam as a physical for your eyes. So your optometrist will keep your records on file so that we can do annual comparisons. We know where you stood last year, the year before, and it just helps us to ensure everything is stable, or if it's not, we're on the right path to be doing some sort of treatment there. So a lot of early eye diseases have no signs or symptoms, and we want to make sure we catch these early enough so that they can be properly treated to preserve eye vision. So the sooner we know, the easier it is for some treatments. And but later stage with a lot of eye conditions, it's very unfortunate that sometimes there's not any treatment or anything we can do about it at that stage. So many of you may already know this, but there is Alberta health coverage towards your annual eye exams. And if you don't have an optometrist, you can find one close to your home by going to the Alberta Association of Optometrists website and using the Find My Optometrist feature. You just have to enter your postal code and a list will come up for you there. So that's great. Next slide, please. So it's a surprise to many patients to learn that during a comprehensive eye exam, their optometrist is checking more than just changes in vision. So as we know, the eyes are windows to many areas of our body and overall health. So we're basically checking for eye diseases such as glaucoma, macular degeneration, cataracts, and it's also when we look for signs of serious medical conditions such as high blood pressure, diabetes, and cardiovascular diseases. So a lot of the time we are the first line to have even caught some of these things where we see some changes in the back of the eye, and then we start working with our primary care physicians or our GPs and dealing with the diabetes or the underlying causes there. So some other health conditions that can show symptoms in the eyes is tumors, aneurysms, autoimmune disorders, thyroid disease, sickle cell disease, liver disease, multiple sclerosis, Parkinson's. and other neurological or brain disorders. So there's many things that can be detected by just looking in the inside of the eye and looking at the health of the eye itself. So we often hear people say that if something was wrong, they would know, but really it's difficult. Sometimes you don't have any symptoms, or you're not feeling, or you see everything normally. So there still can be issues, and it's really important to consult your eye doctor, or if you don't have one, to get one in there. Early diagnosis, like I said before, of any disease is important to have effective treatment. So that makes annual exams an essential part of a health regime. So going back to that question that we were talking about, it's recommended to have annual eye exams. Okay, next slide, please. So here, let's review some of the more prevalent eye diseases and how they can impact your life. Okay, so if you look at this photo here at the top, I know some of you have called in, but it shows a disease known as macular degeneration, which causes the center of your vision to blur or distort, while the side or the periphery of your vision is still intact. So it is generally related to aging, and it is the leading cause of blindness in North America in adults over the age of 55. There is currently no cure, but there are treatments to help preserve your vision. So from a prevention perspective, lifelong UV protection and good nutrition are believed to play key roles here. So if you can live a healthy lifestyle by keeping your blood pressure down, reducing your intake of fatty foods and not smoking, these are all some of the recommendations to help prevent macular degeneration. But number one key is having that UV protection and eating a healthy diet. I would strongly emphasize on those two points there. There is some research that shows that the people that smoke and the longer they smoke, the higher risk they have of macular degeneration. So it says that smoking increases the number of damaging chemical compounds, and it reduces the number of protective nutrients delivered by the bloodstream to the eye. So, and also smoking reduces oxygen and blood to the eye. So, we want to decrease smoking or stop it altogether if we can. The good news is that there are studies now that show that former smokers have only a slightly increased risk of developing macular degeneration compared to those who have never smoked at all. So even if you stop smoking now, you still only have a slighter risk than someone who's never smoked at all. So, it's like I say, it's better late than never. So it's good to stop if you can. Next slide, please. So here we're going to talk a little bit about cataracts. We always hear this word cataracts, and with cataracts, the normal lens inside of your eye starts to become cloudy as we get older. So cataracts are a function of aging, and they are found mostly in people over the age of 60, ballpark estimate, although they can be found in younger people as well. And sometimes we see them in newborns as well. So there's not a hard and fast rule there, but generally it's an aging process that happens to that lens inside of our eye. And risks can include things like injury or disease or excessive exposure to UV light, cigarette smoking, again, and certain medications. So right now, there's no proven method to prevent cataracts from forming, but there is research that says wearing good quality UV protecting sunglasses has a very big benefit, and a diet rich in antioxidants such as vitamins A, C, E, and zinc, selenium, and magnesium can also be beneficial. So, also not smoking. So again, like I said, smoking just does not do any good to the eye at all. So yeah, next slide, please. On this one, we're going to talk about glaucoma. So again, glaucoma is sometimes called the silent thief. So you usually don't have any symptoms until it's a very late stage, until you're very late stage in the process. So this disease causes a decrease in your peripheral vision, so sideways vision, if you like it. Remember, going back to macular degeneration, that guy was affecting your central vision. This one is harboring in on that peripheral vision. And it's most frequently occurs in individuals over the age of 40. with the risk of increasing as you get older. So age is a big risk factor here. And there's a bigger risk for those of us who have diabetes. So if you have diabetes, high blood pressure, or a history of eye injuries or a family history of glaucoma, you're more likely to have glaucoma. And I get asked this a lot in clinic, is there a way I can prevent glaucoma? Unfortunately, there's no way to prevent glaucoma, but again, having a comprehensive eye exam with your eye doctor is the only way to really detect this disease early enough. And even if you don't wear glasses or you think you see well enough, these regular eye exams can still help you if we ever need to detect or diagnose glaucoma for you. Okay, next slide, please. So optometrists also examine these tiny blood vessels in the eye, and these can be indicators for diabetes. So as many as 1.5 million Canadians are living with undiagnosed diabetes. And optometrists are often seen as the first line of diagnosing diabetes because we see these patients quite regularly in our clinic. And we also see a lot of patients that have not been diagnosed before as well. So like I said, we work closely with your primary care physicians, with other, sometimes even neurologists, depends on what's going on. We're all in our circle of care here. So it's really important that you do get your eyes tested to make sure we can see any changes due to diabetes. So a big fancy word that we use, it's called diabetic retinopathy, where there's a weakening or swelling of these tiny blood vessels in the retina of your eye, resulting in blood leakage. And the growth of these new blood vessels can cause damage to the eyes, and it can cause damage to your vision. So if diabetic retinopathy is left untreated, it will lead to blindness, okay? So it's very important to manage that blood that's in the back of the eye and make sure that we treat it how we should. In the early stages, retinopathy is often asymptomatic. So usually patients don't have any symptoms in the early stages. And the complications of diabetes can affect many parts of the eye as well. So it can cause changes in your nearsightedness. It can cause changes in your farsightedness. It can lead to premature presbyopia, meaning you may need glasses for reading sooner than the usual. You may lose focus on close objects. You can even get early cataracts with diabetes. Early, and glaucoma can happen as well. So there's many eye diseases that can happen with diabetes that will affect your vision essentially. Another point I want to bring up is that diabetics generally have decreased corneal sensitivity. So if they get something in the eye or hair or something in the eye, they're less likely sometimes to feel it because their nerves are less sensitive. So it's very important to not rub your eyes vigorously, or if you feel that there's something in the eye, if you can rinse it out with saline, great. But if not, always come and see someone, because we would be able to look at it under the microscope and help you further, okay? So what are some of the symptoms that you would have? Well, it can fluctuate. So you can have fluctuations in your vision, you can have blurry vision, you can have loss of your visual field, you can get floaters and flashes of light within the eye. So basically, from a prevention perspective, you want to keep your blood sugars as in control as possible as you can to reduce the risk of diabetic retinopathy. So, see your family physician and follow the instructions that they give you about diet, exercise, and medication. And your optometrist, of course, and your physician can work with you to co-manage the disease as well. So next slide here, we'll talk a little bit about dry eyes as well. And this is very, very common. So I'm in Calgary and I see this all day long because we're pretty dry out here. And dry eye occurs when your eyes don't produce enough tears, or they produce tears that just don't have proper chemical composition. So this can result from normal aging as well, but it can be other reasons too. So there can be hormonal changes, exposure to certain environmental conditions, problems with blinking, or even from medications such as antihistamines or antidepressants as well, okay? So Dry eye can also be a symptom of general health problems too, so such as arthritis. And so some of the symptoms, well, like people ask me, well, what is dry eye? What will I feel? Well, you're gonna feel stingy, gritty, scratchy, uncomfortable eyes, okay? Maybe fluctuations in your vision. So a lot of patients say every time I blink, it clears up and then it's blurry again. So that could be a symptom of dry eyes. You can have a burning feeling or a feeling of a foreign body in the eyes, like you have a hair in the eye. But in moderate to severe cases, you may experience blurred vision, light sensitivity, or even periods of excess tearing. And if left untreated, it can be pretty harmful. Excessive dry eye can damage and possibly scar the sensitive corneal tissue of the eyes, and that can impair your vision. So once the cornea has a scar on it, it's very hard for us to treat that. And so, you know, we don't want it, we don't want the end stage of a scar to happen. And I'll really reiterate that dry eye is a chronic disease. Okay, so it is something that stays around. It doesn't happen overnight. It does have its own build up in the process, but it is a treatable disease. And there are several options, and your eye doctor can recommend the best treatment for you based on the severity of where your disease lies, if should you have dry eye. So I'm just going to go to the next slide here. So another poll question here, but again, I know we're not voting or anything, but just keep it in your mind. What is the leading cause of injury among seniors? So do you think it's vehicle accidents, falling, or skipping rope with grandkids? So next slide here. So falls, if you answered falls, that was the right answer, because falls are the leading cause of serious injuries amongst the seniors, okay? And seniors with low vision are more than twice as likely to fall. Unfortunately, 1 in 3 Albertans over 65 will fall this year, and 78% of Alberta seniors who are hospitalized with an injury have suffered a fall. So as most people age, their vision needs change, and some changes that you may notice include maybe identifying objects is more difficult for you, especially at night, or you know, judging distance is a little bit more difficult, or everyday tasks like reading, or you know, things like colors are less bright for you, the contrast is less noticeable. You may find that your visual field is narrower, and fewer tears are produced, like we talked a little bit about dry eyes as well. And so what are some of the actions you can take to improve and protect your vision and prevent falls? Well, one of the number one things you can do is use high wattage light bulbs. Okay, these are great and they will definitely help with you to increase that contrast and just see a little bit sharper where you are. Because as we were talking about that cataract, as it gets cloudy, it's going to require a lot more light to hit the back of the retina than that clear crystalline lens requires. So high wattage light bulbs are great. Use night lights or motion sensors if you can in the bathroom, in hallways, you know, in dim lit areas, have those around. Mark the edge of stairs with colored paint or treads if you can. So it gives you, it enhances the contrast there instead of having a white railing with white stairs. That can be difficult to sense sometimes. And keep the lighting similar in every room so you're not changing from different amounts of lighting all the time, so your eye is not having to adapt to that. And again, you can also speak to your eye doctor about multifocal lenses. Now, these are contact lenses that are essentially for distance and reading. So for our patients that just want to not wear glasses once in a while or do not like wearing glasses, there are options out there for vision improvement with those as well. So next slide here. There can be reactions to medications as well. So blurred vision, double vision as well. So it's important to speak to your prescribing doctor to make sure that you're not falling because of your medication that you're taking. This would be something that your primary care physician deals with you, okay? Great, so next slide here, perfect, thank you. We're taking mini breaks, yeah. So, you know, we're all spending more time looking at screens or laptops. I've even got 2 screens open here as well, and smartphones, TVs. So we need to avoid straining our eyes. And the strain on our eyes can cause things like headaches, excessive tears, and even dry eyes. So every time we look at a screen, our blink rate decreases. So we get so into what we're doing that we forget to blink essentially. So, you know, and this can lead to eye fatigue and tiredness, which is essentially a real thing. You know, I get asked about it, is eye fatigue real? And it really is a real thing. So some things you can do is positioning your screen at about arm's length from your eyes and about 20 degrees below. So stretch your arms out. If your screen is any closer than that, push it back a little bit and have about a 20-degree dip. So it should be a little bit lower, so you're not looking directly at the screen. This just helps with reading, and there's research on that as well. So keep your room lighting at the same brightness as your computer screen. So try not to stare at your screen in the dark, okay, that, and blink fully. People tend to blink less, like I said, so, and you don't, and sometimes we do an incomplete blink when we're on the computer, so we don't close our eyes fully. And your optometrist can help ensure it's not an inappropriate prescription that's causing eye strain too. So if you're wearing the wrong glasses, that can also cause eye strain. And so make sure you see your optometrist to make sure that your glasses are up to date. And also take mini breaks, okay? So every 20 minutes, take a 20-second break by focusing on something 20 feet or further away. So I call this the 20-20-20 rule. So every 20 minutes, take a 20-second break and look at something 20 feet away and come back in. And that's a great exercise for all of us who are on the screens all the time. So next slide, thank you. We'll talk a little bit about urgent and medical care as well. So your eye doctors have the knowledge, the tools, the equipment, everything that's necessary to diagnose, treat, and or refer to a different specialist if need be, right? So as eye doctors, they can treat eye infections, they can do minor eye emergencies such as scratched cornea, foreign objects in your eye, inflammations of the eyelid, and sudden changes in the vision. So because optometrists also monitor for diseases like diabetes and glaucoma, and they also provide post-operative care for patients, they work closely with your general physicians, so your primary healthcare practitioners. And by working together, we try to improve the patient outcomes. So if your optometrist refers you to, you know, a rheumatologist or a dermatologist even sometimes, or say an ophthalmologist for certain things, you would be going through a series of steps. However, you would know, you know, you're in the right hand. So if you come for an eye problem and it's something more, it's diabetic retinopathy, well, we know maybe we need to deal with your family care physician. Okay, if we're seeing inflammation in the eye, and it's the same sort of inflammation we'd see in someone who has arthritis, well, maybe we'd have to look at something with your rheumatologist and maybe get you on some medication for that as well. So like I said earlier, there is Alberta health coverage towards urgent care and medically necessary appointments, and this applies to all Albertans. So above 65, the annual exam, routine exam is covered by Alberta Health, but urgent care and medically necessary care is covered for all Albertans. So next slide, please. I'm just going to talk a little bit about diet here, change gear for a little bit. So there are some superfoods that have been identified as helping to maintain eye health. So you may have heard that the beta carotene found in carrots does improve your vision. But however, there are other superfoods out there that you should be eating to protect your eyes. Okay, so the lutein and the zeaxanthin that you get from vegetables such as kale, spinach, broccoli, lettuce, these are crucial and they protect the eyes from light-induced oxidative damage. Okay, so that basically we want to be eating our leafy greens to prevent or try to slow down macular degeneration. So I know we all know what macular degeneration is. We're screaming out that it was that blurred in the center of the vision. So just make sure for good eye health, eat your leafy greens because it has the lutein and the zeaxanthin that we need. Now, the zinc found in eggs is important for vision as well because it helps to maintain the mineral levels in the retina, so the back of the eye, while building our biological pigment, which we call melanin, which protects the eyes. So zinc in eggs is good as well. So make sure we have a good source of zinc. Vitamin C can lower your risk of developing cataracts, and it slows down the age-related macular degeneration as well. Berries, so you got your blueberries, your raspberries, your blackberries, strawberries. These will give your body that extra boost of vitamin C as well. Okay. Almonds are great, so they're an easy snack to pack, and they're full of vitamin E. And this vitamin plays an important role in certain parts of the eye by neutralizing that oxidation, which is important as the lens of the eye is particularly susceptible to that oxidative damage. Okay, so that damage, that oxidative damage, is the one that causes our cataracts. So making sure we get enough vitamin E for our eye is also very important. The omega-3 fatty acid found in fish is also really good for your retina and your brain health as well. So it is also known to help with dry eye. So you can also get omega-3 multivitamins as well, but if you can get it from the fish source, that's wonderful. And these are things you can pack into your meals. You know, you can also, these are easy things that you can, everyday things that you can take as snacks or as fruits or anything you like. It's very easy to eat these throughout your day. You can also access the Eye Health recipe book on the association's website. If you belong to a group and would like to distribute the cookbooks, just give the association's office a call, or you can reach out to me as well. The cookbooks are free of charge, and they have some really great things in there for eye health. We'll talk a little bit about, next slide here, sorry, a little bit about diet or exercise now. So again, just like diet, exercise goes hand in hand. So exercise is very important to maintaining our eye health. 2 recent studies have found that people who engaged in moderate physical exercise were 25% less likely to develop glaucoma than people who were largely inactive. So, and in another study, scientists found that people who exercised at least 3 times a week were less likely to develop age-related macular degeneration. And people with diabetes, that can help keep their disease in control. So what do I mean by moderate physical exercise? You know, it's going for a walk 3 times a week can lower your, you know, your intraocular pressure as well, and improve the blood flow to your retina and in your optic nerve. So why do we want to make sure our intraocular pressure doesn't spike? Well, the higher it is, the higher the risk is for us to possibly get diagnosed with our condition known as glaucoma. So just a recap on that. So healthy diet and exercise can really help keep your eyes healthy throughout your life. Next slide, please. So regardless of your age, it's important to protect your eyes from ultraviolet radiation, okay? So also known as what we call UV light. So the invisible rays are from the of the energy emitted from the sun, and it happens 365 days a year. Okay, so the reason I like to kind of just emphasize on that is, you know, a lot of people say, oh, it's winter, I don't need my sunglasses. Well, these rays are emitted throughout the year, in fact, so you should be wearing sunglasses even in the winter time. Okay, because when the eye absorbs too much UV light, it can lead to serious eye conditions like cataracts. Retinal damage can occur. There can be some growths on the front of your eye. We have big fancy names for them, pterygium, pinguvecula. But basically, it can damage any part of the eye. So very important that we are using our sunglasses and that they are protecting us from the UV light. So speak to your optometrist about the best sunglasses for you and your vision. And yeah, enjoy the outdoors in all seasons. Make sure you're having a good time, even when you're wearing your sunglasses. So next slide here, please. So I just wanted to go over, just the one before this, sorry. So we are often asked about, thank you, perfect. So we are often asked about how often you and your family members should visit an optometrist for a comprehensive eye exam. Okay, so I'm just gonna go over the guideline. The first appointment should be between 6 months of age and 9 months of age. Okay, so as early as 6 months, we can start seeing them. Newborns are usually screened at the hospital, so a lot of eye doctors work at the hospital and they're already doing that. But for a routine eye checkup, we start seeing them at 6 months. And then again at 2 years of age. So 6 months, between 6 and 9 months, then 2 years. At 5 years, when they turn 5, you want to see them each year until their 19th birthday. So from 5 to 19 every year. Okay, so believe it or not, 1 in 4 children have a vision issue, and these appointments can be very, very important for them. There are things that we can do early on for children to help with vision development. So if one eye is not developing, there are things we can do to ensure both eyes have the same advantage and develop so that the child has good binocular vision growing up. So there is Alberta Health coverage. I just want to mention that as well until your 19th birthday. So Alberta Health will cover your routine eye checks until your 19th birthday. Then between 19 and 64, it's good to book an appointment about every 2 years. Okay, you can still go annually, but at least every 2 years is the recommended guide according to the guidelines here. And then when you reach 65, we recommend an annual examination again. Okay, so there is again Alberta Health coverage again after 65. If you don't have a regular optometrist, you can go to the optometrist.ab.ca and click on find an optometrist. And by entering your postal code, you can find someone who's close to you, close to home here. Okay. And just here on the next slide here, we're gonna just go over the checklist. So things to have on your checklist after today's talk would be, book your annual eye exam if you haven't already. If you don't have a regular optometrist, you can find one online. You can reach out to me as well if you need to. I can help you find someone. If you're in Calgary, where you are, we take new patients all the time, so you'd be welcome to join our clinic. But I would strongly recommend finding someone close to where you're located, just because it's easier if you need to go for follow-ups, and the commute can be difficult. You don't want to be going out of your way for that either. Follow the tips to preventing falls. Okay, so for a full list of tips, you can check out findingbalance.ca. Correctly position your computer to avoid any digital eye strain, and remember to take those mini breaks we talked about, the 20-20-20 rule. If you need urgent care ever, call your optometrist. There is Alberta Health coverage, so don't worry about having to pay something if you need care. Urgent care, I should say. Eat a diet with a abundance of fruits, nuts, and vegetables. So we talked about that, the vitamins necessary for the eyes. Get regular exercise, and last but not least, wear your sunglasses in all seasons. So not just the summer months, in all the seasons. And that kind of sums it up here for me today. So, for more information, like I mentioned, the optometrist.ab.ca website, you can head on over to that website. And yeah, I thank you guys for having me here today and wanting to hear from me. So that was great, wonderful. And are there any questions or anything else I can answer for anyone?
Yeah, let's see. We've got Helen is asking if UV protective level of prescription sunglasses diminishes if you continue to use the same pair over multiple years due to not requiring a new prescription.
Yeah, great question. So usually, 2 to 3 years, if there's no scratches or if you haven't dropped them or anything like that, the filters inside are generally still viable. However, you can take your glasses to your optometrist and they should be able to see if they are still blocking out the amount of UV that they should. We have loads of gadgets in clinic that we can see. So give your opticians a call where you got the glasses. And even if you didn't get them from that particular opticianary, you can still go in and see if they're still doing the trick. Great question.
That's awesome. Thank you. I just want to leave it open for a second in case anybody is typing.
Great, yeah.
Just because we haven't, that was a great presentation. I know I learned a lot. It's always such a great reminder, right? That when you nourish your body, you're nourishing all of it, including your eyes.
Exactly. Yeah, that's right, Nicole. Yeah.
Kevin is saying thank you very much.
You're welcome.
I think we're probably done. So just a reminder to folks that Dr. Toor has volunteered for time today. So we're super grateful to have your presentation. And that's it. Well, I think we can probably shut it down until our next session at 3 o'clock, which is Learning Resources at Edmonton Public Library.